Welcome to our pelvic floor and core video where we are bringing it all together. In the next couple of weeks, we'll be working a lot on pressure management, core strength, and breathing mechanics. So in order to do that, we need to take a look at the pelvic floor, the core, our breathing system, and the difference between a deep and a shallow breath and how all of that impacts pelvic floor and core recovery. So when we look at our core canister, you have your diaphragm at the top, your pelvic floor on the bottom, your abdominals in the front and on the sides, and your multifidi in the back. The diaphragm is a dome-shaped muscle that sits at the bottom of your lungs. And when you take a breath in, the diaphragm descends down and flattens out. When you take a shallow breath, you only fill the top of the lungs. When you take a deep breath in, you get air down into the bottom of the lungs. The diaphragm flattens out, allowing the rib cage to move, expand out to the sides, out to the front, and out to the back in what we call a bucket handle movement pattern. During pregnancy, as your baby grows and you have less space in the abdominal cavity and everything gets pushed up, your rib mobility lessens. Your diaphragm is unable to descend down and you're unable to take a full breath in. This dysfunctional movement pattern can linger into the postpartum period. And so we will be working a lot on breathing mechanics so that you can get a deep breath in to restore rib mobility. And this will allow better diaphragm mobility. And allowing better diaphragm mobility would allow better pelvic floor mobility. When you have diaphragm mobility and the diaphragm is descending down and flattening out, it increases the pressure in your abdominal canister. It pushes pressure down on the pelvic floor, out on your abdominals in the front, and out into the back on your multifidi. So we need the abdominals, the pelvic floor, the multifidi, and the diaphragm all working together to help manage pressure within this space. If one area is lacking, we can have pressure bulging out in one space more than the other, leading to a diastasis recti, which is the separation of the ab muscles in the middle, bulging down too much into one area, like the pelvic floor, leading to leaking or prolapse or pelvic heaviness, or even bulging into the back, causing SI issues or low back and hip pain. So our goal is to get all of these muscles working together and to restore breathing mechanics so that we can then strengthen the pelvic floor and core. So these first 4 weeks will generally be focused on restoring this dysfunctional movement pattern that lingers from pregnancy.